Hello, my name is Shane Barnes, and today we'll have a brief overview of medial tibial stress syndrome, otherwise known as shin splints, but that would be a garbage term. Medial tibial stress syndrome, or MTSS, is commonly found in runners who suffer from pes plantis and pes cavus, but it can also be found in other sports. MTSS involves the inflammation in the periosteum to the bone and excessive pronation, which means the soleus will be ripping from the tibia. Some signs and symptoms that you may come across with medial tibial stress syndrome would be point tender in the posterior medial side of the tibia and increased pain with resistive plantar flexion. Now I'm going to inform you of a few techniques to help prevent MTSS. As we know, excessive pronation of the foot can lead to MTSS, and the use of orthotics can help by supporting the arch and putting the foot in the proper alignment. There are also some taping techniques that can help as well. An example of one taping would be the medial arch taping. I would first begin by taking the heel and lace pad and putting it on the medial arch to provide support and extra cushioning. Second, I'll take Elastoplast 3 strips and pull it from the lateral to medial side to prevent excessive pronation of the foot and prevent the navicular from dropping. Last, I'll take light plast, and I would just close it. And now the athlete is ready to go out and play or practice or do whatever he or she has to do. Some other things to be aware of are to wear proper shoes and to change them every 400 to 500 miles. Also, it is important to run on a terrain like grass or dirt surface instead of pavement most of the time. Now we go to Brendan Cash for treatment.
Thanks, Shane. Now we're going to look at treatment for MTSS. There are various ways for treating medial tibial stress syndrome. Some very common ones include orthotics, taping, non-steroidal anti-inflammatory painkillers, exercises with a TheraBand, and of course RICE, which is rest, ice, compression, and elevation. Today we're going to demonstrate one of the many tapings for medial tibial stress syndrome and show exercises that can be done with a TheraBand. The first exercise that I'm going to do with TheraBand is I'm going to pull laterally from the medial side of her foot while she inverts her foot. And this is, while stretching the everters of the foot, it is strengthening the inverters of the foot. There are many ways you can do, many things you can do with a TheraBand, but we're trying to keep this video short, so I'm just going to go right into taping, one of the best taping jobs for medial tibial stress syndrome. First, I'm just going to pre-wrap her. Now what I'm going to do is put the elastoplast. I'm going to start up here. Now I'm going to make sure her foot is in dorsiflexion, and this will prevent her from going into plantar flexion, which increases pain for medial tibial stress syndrome. Always want to do 2 of these to give it extra support. Now what I'm going to do is just close it off and basically clean it up. And I'm doing this with the light plast, so it gives it a little more stretchiness. I hope our video has given you an overview of what medial tibial stretch syndrome is, prevention of it, and how to treat it.
Thanks for watching our video, and please enjoy the rest of the site.